Hello, down here. Welcome to Podiatry Practice Mastery, where we're helping you get your practice to the $1,000,000 mark and beyond. This is a recording of a Monday in the practice. I want to talk about a few things. I've been working on something called the closer formula. So closer is an idea that I got from Alex Hormozi. I've been really liking his ideas, and this is kind of a sales technique of how to it's like a psychology technique, and it's really similar to what we already do. There's only one nuance, or maybe two nuances, that we don't typically do in our practice. So let me explain what it means. So letter C is to clarify. So basically all this means is patients come in and we say, okay, tell me what's going on, and they'll say, oh, I have bottom heel pain when I get up, and okay, tell me more. And so as you say tell me more, they will continue to go into more detail. That means that's the clarify component. L is label, so you label it. So you say you do have plantar fasciitis, and that's what the L means. The O is you have to give it kind of go deeper into that, and okay, how long has the pain been going on? What treatments have you tried? How much are you struggling? That's O. The S is for sell the vacation. And so this is the one where I think we're not very good at doing it, or I shouldn't say maybe where I am not very good at doing this. But this is the part where you say, okay, so you have this going on. Usually what I would do, even before I sell the vacation, I would go, okay, here are the treatment options. Okay, that's what I'm trying to learn how not to do, and it's hard to learn how not to do something that you've been doing for a while. But selling a vacation would be okay, Mrs. Jones, it sounds like you have heel pain. It hurts in the morning when you get out of bed. You've tried all these other things. It hasn't worked. What would be like if we were meeting here in 3 months and you didn't have heel pain? How would that be for you? What could you do that you can't do now? And they would probably say, I could get up. Life would be much better. I can play with my grandkids. Be so happy. So that means selling the vacation. And then the next part would be E, is explaining any kind of possible objections, or explaining any possible questions that they might have about your treatments. And then, so with that's actually almost where you kind of say, okay, well, you probably think it's going to be really expensive to treat plantar fasciitis. You probably think you're going to need orthotics. You're going to need Shockwave, maybe a cortisone injection. But I'm here to tell you, you don't need to start with that thing. We have two different phases of treatment. So what I did there is I said, okay, patients probably have on their mind, am I going to have to have a shot? Am I going to have to have surgery? Am I going to have all this long physical therapy, all the other things? And so by preemptively telling them that, you put them at ease. So what you could say is all the things that they don't need. Okay, so just so you know, Mrs. Jones, you're not going to need surgery. Okay, you're not going to need a cortisone injection at this point. You're not going to need lengthy physical therapy. You're not even going to need orthotics at this point. Okay, because we are starting out. So I have two phases of how I treat plantar fasciitis: phase 1 and phase 2. We're going to start with phase 1 today, which involves my Pelto special, which is light split and foam rolling, morning stretch, anti-inflammatories, and then I'm going to see you back in 3 weeks. We'll see how you're doing. If you're better, that's great. If not, we'll go on to phase 2, which involves an ultrasound, and then the other treatments, which might be shockwave therapy, orthotics, amniotic injection in that area to help speed up the healing. So it's kind of a way of preemptively going over and explaining kind of what are the possible things, and then you can go over the treatments with the patient. So this is something that's really, really helped me, and I think might help you guys. Okay, so let's get into it. The MVP patient. This is one that's a 63-year-old man, and he had left plantar fasciitis. He's had it for about 6 months. He tried physical therapy. He tried night splint, foam rolling, morning stretch, anti-inflammatory, and he had one cortisone injection. So all I did for him is I pulled up my phase 1, phase 2 for plantar fasciitis. So once again, if you want this, okay, you can go to patientpresentations.com, and you can just put your name and email, and it'll send you a link to all my presentations. You can see phase 1 and phase 2 on this plantar fasciitis, okay? And so phase 1 is the things that he had already tried, and phase 2 was the things he hadn't tried. So all I really had to say, and this was just pretty amazing, I said, okay, so we're going to do phase 2, which involves We're going to do 6 sessions of Shockwave. If you'd like, we can see if we have time to start the first one today, if you haven't had any anti-inflammatories. At week 2, we're going to do an amniotic stem cell injection to this area that's chronically inflamed to help speed up the healing. At week 3, we're going to scan you for orthotics because your heel's not going to feel better until about week 3, and then they'll be done by week 6. And he said, okay. Like, that was it. So I showed him one slide. He said okay to everything. He didn't ask any other questions. Now, this might have been because he was my patient before. It might have been that I had already, we'd already tried all the other things, and he was not interested in another cortisone. He was not interested in more physical therapy. But this was my MVP patient, so as he left, he prepaid the 6 Shockwaves. My staff did not ask to prepay the amnio or the orthotics, but he certainly could have done that as well. But I find that prepaying, we say when they're leaving, they can either prepay or pay one as you go, but if they prepay, they get 10% discount. So if it's $1,500, they'll get $150 off. Most people, they want to do that and helps them to complete all the treatments. Okay, let's see what else we did today. The first patient was a 62-year-old man. He was for a right third-digit dehiscence. It's looking better. He had a little dehiscence after in-office amputation. I put a couple of stitches in about a week ago. I'm going to see him back in another week, and I shockwave the area. So I don't do many wounds at all. If you ever listen to these, there's very few wounds. This is one of my man-made wounds, and I'm doing shockwave just to ensure that this thing heals, so I don't have to do anything else. But I did a focused only shockwave. Did not charge him for the shockwave, by the way, when I did that. Next was a 36-year-old female. She had previously seen someone else for laser. I did a prescription for LFTs, and I did a prescription for terbinafine. Now, the low point of the day was, as I was saying, okay, you're going to get my UV light, shoe spray, and Theranail. The staff automatically said, we don't have any UV lights. And I asked them, well, why? We should always have UV lights. Well, I told the staff in the back, and that other staff didn't tell the other staff that was supposed to order it. So this I kind of got a little upset about today because she promptly went to Amazon and she purchased her own UV light. And so this was something that I said, I didn't tell them, but I thought, this is just taking, let's say if it was $100, it's taking $30 out of my kid's pocket, and because we didn't order them. So, and then this repeated itself throughout the day because I had a couple of nail patients and we didn't have the UV light. I asked them to make a list, and we would get them to them as soon as possible. So that was the first patient. Second patient, 47-year-old, got Lamisil as well, got a nail sample, and LFTs, and also got my Pelto nail fungus kit, and there was no laser for that one either, or UV light for that one either. Next was a 59-year-old female, a left ingrown. She had seen another podiatrist 9 months ago who said, this nail will not grow back again. And it grew back again. So she had reduced confidence in that doctor. And I always tell patients that will come back. Even if I do a matrixectomy, sometimes it can come back. And I did a matrixectomy on her. See her back in 3 weeks. Now, a lot of these patients, just so you know, I have this page that I use. It's called a daily treatment tracking sheet. And on here you're going to see I have their age, I have their follow-up, and a lot of times I do a 10-minute follow-up. And these are really nice, these 10-minute follow-ups. These are simple things that aren't going to take me a lot of time. And it's a way that I can either just do 2 10 minutes or I can do a 20-minute for a new patient, but it doesn't really glut my schedule. So these are just quicker follow-ups. Like that, matrices are quicker follow-ups, Lamisil follow-ups are like that as well. Next was a 72-year-old female. I'd previously given her fluconazole. She never took it, so I prescribed it again. And she's going to do that. She also got, or she was supposed to get the UV light, shoe spray, and biotin, but we didn't have the UV light again. So third patient of the day. Next was a 34-year-old female, had right hallux total avulsion. I'm going to see her back. This was a patient, I did a staged procedure. So onycholysis, wavy toenail, kind of layered toenail. The proximal 1/4 was attached. We wanted it to get to reattach. It hasn't been reattached in years. I said, okay, either you can do Cariflex the rest of your life, or I can pull this thing off, and in 4 months we'll do Onifix to try to get it to reattach. So I'm using more Onifix, frankly, to get nails to reattach than I am for ingrown toenails. I wish I could say I use it a lot for ingrown toenails, but I still do mostly nail avulsions for those. Next patient was a 42-year-old female, had chemotherapy. I did a left hallux nail sample, and she had on the right an IND. She had an ingrown toenail. Next was a 39-year-old female. She had an orthotic follow-up, and I used my new wording. I forget who I learned it from, but my wording is this. Okay, when they come back, by the way, you have a discount. In your package, you can get $200 off for your second pair of orthotics, and I find that a second pair of orthotics, if you're pleased with the first one, really increases compliance and helps your symptoms not come back. So compliance meaning you don't have to switch it from shoe to shoe. They can order those for you on the way out. And so my patients, this one, got a second pair of orthotics. Next patient was an orthotic follow-up, and this patient had a painful arch from the orthotic, and so for this one I heated it up and I lowered the arch a little bit, and I did send them back. Not send them back meaning I took a picture and I asked my lab to make a new pair. I also told her she may have had a problem with the orthotics because she had a motion control shoe, and sometimes I find that increases the arch too much and causes the orthotics not to be comfortable, so I recommended her getting a new shoe as well. Next was a 35-year-old man, left a nail sample, and he also had a left heel wart, and he came in and he just wanted it out. I think sometimes for one wart I'll just remove it, so I just removed it in the office with light with Epi. He's going to come back in 3 weeks to go over the nail sample and also to see how the wart is doing. Next was a 64-year-old female, left second met, had number 4 out of 6. She had an amnio 2 weeks ago, and she's number 4 out of 6 in pain to the second med head. She's still a little concerned right now. I just kind of reassured her. I think with Shockwave, a lot of our time is spent reassuring patients because, I know it's going to kind of turn the corner here eventually, and she also paid for her orthotics. So we scanned her last week, but she did not pay for them, so we don't order them until they pay for them. That was the morning. Afternoon was a 75-year-old female, had left edema to the 5th met base, and this was interesting. So she had, I think she had just a cellulitis on her 5th met base, and she had pain, and it took a long time, a couple of rounds of antibiotics, and now her foot is feeling so much better. I actually did an MRI because I was kind of concerned if she had osteo or anything else in there, but her foot is looking so much better, no redness, a little bit of edema in that area, but it hurts her. Like the swelling hurts. And so what we did for her is we said, hey, you can give it time, but what I find, and this is the expression I say, so if we do Shockwave, it'll speed up the healing by about 50%, and it's 82 to 85% successful. So this speeding up the healing by 50% is what I mean is your return to activity is about 50% faster. And this is especially beneficial for people that are like athletes. So especially if you have like a fracture, they can get back 50% faster, whereas a lot of times it can sideline them. Because even though the fracture might be healed in 6 to 8 weeks, it takes them extra weeks to get back to activity. So this is kind of how I explain it to patients. So next patient was she had a 33-year-old female. This is kind of interesting. She had a arthroscopic knee surgery that then led her to have some right foot pain from knee to I think it feels more nerve. And the reason I think it's nervy is because she has pain to the 3rd met, kind of in the sulcus, kind of around where the neuroma area is, but I can hardly get up at all. Like my focus is at like 0.03, and my radial is like 1, and she can barely tolerate it. So I find these tend to be more like nerve issues, and she is number 6 out of 6. She's already feeling better, but I told her just to be patient because nerve things can take a long time. So I'm going to see her back instead of at the typical 6 weeks. I'm going to see her in 3 months, and we did an office visit as well because that was the last Shockwave. Next patient was a 64-year-old at an x-ray, had a second toe contusion, was concerned about if there was a fracture. There was no fracture on x-ray, but she also had a kind of a painful Taylor's bunion, was having a hard time finding shoes. So I recommended Topos and Ultras and some of the other shoes that I recommend. Next was a 48-year-old man. He had a left Shockwave follow-up after 6 sessions. He had a second-digit hammer toe with overloading to the second met head and possible kind of plantar plate / tear in that region / stress fracture. And so he is like 90% better. I was a little concerned with him because this is not his first follow-up, it's a second follow-up. So the first one was 6 weeks and the second one is 12 weeks. So what I do with Shockwave is I tend to do the first follow-up at 6 weeks, and if they're feeling like 60% better, then I'll do another one double that time in 12 weeks. Now if they're feeling really not much better, I might even do another Shockwave at that time with no charge at the 6-week follow-up, and then at the 12-week I'll do another Shockwave with no charge if indicated, if they're having pain. But this guy was certainly feeling much, much better with this. Next was a 48-year-old for left EPAT follow-up. For a right peroneal pain. The right peroneal longus / brevis. Number 4 out of 6 is already feeling better. Next was a 63-year-old with, this is that MVP that I was telling you about. Next was a status post MRI of the 5th med base. She's still in pain. And this one, we did EPAT number 1 out of 6. So this one was having kind of 5th met pain and swelling, and really wanted to get back to activity due to her trip. And so we're going to do we did 1 out of 6 for the Shockwave. Next was the left ball of base of the hallux paronychia. This was a really bad, I guess, retronychia, paronychia, probably a paronychia on the side that went central. And I did an IND. I also made a video of this one. So I'm starting to try to do new videos and teaching my staff. Now I learned a neat tip I'll tell you about. Actually, the last patient was a 4th met head pain, and I did an x-ray. And this one had a painful callus, so I trimmed the callus, possible wart, so I did lesion destruction, and I did an x-ray, and I will possibly do an orthotic in the future if it comes back. So what I want to share is my tip was with CapCut. So if you don't use CapCut, it works pretty well. I was kind of struggling. I had a couple of issues. One is I was using Submagic to put subtitles on my YouTube shorts. What I found, though, when I record, I can't flip the camera. And so a lot of times with doing shorts, I was just showing the foot, and I wasn't really doing like that whole talking head that patients like, and that it just makes it more fun. So you can kind of explain the condition, and you can flip your camera, and you can't do that with Submagic. You can't even do that with your native iPhone recording. So what I found with Submagic is you can there's a quick link you can add to your home screen. So it's like a whatever these are called. Like if you add the app in there, you can add these. I don't know. They're called the quick links, and so you can go right to the camera, and you can do. I think it's called multi-take. So you can do multi-takes. So you do 3 minutes, and you take and you hit record, and then you can stop it. Then you can record you talking, flip at the camera, record the foot. And then at the end, you can flip the camera and show yourself again. And then I can export it, and I export it to Google Drive. There's a Google Drive that my virtual assistant then takes and does all the other things with the captions and then uploads it and things like that. So it's making it a lot easier for me to make videos, and that's been kind of fun doing that. So anyway, this is the day. I hope you guys found this beneficial. We kind of talked about a lot of things. I hope you guys try this selling the vacation thing. I'd like to know what your thoughts are, if this works for you, or what other tips that you have for like communication skills with patients. Okay, until next time.